Hey everyone, welcome back and you're watching your medicine channel MMS, which makes medicine simple. Yes guys, medicine is fun if you make it simple. So once again we are continuing our rheumatology series of lectures, and today we will talk on osteoarthritis, also known as degenerative joint disease. So primarily it's two types: primary osteoarthritis and secondary osteoarthritis. Primary osteoarthritis is the disease of elderly patients, a disease of joint use, right? A biomechanical problem, a wear and tear problem. So here is the beautiful picture of one of my osteoarthritis patients. She came to my clinic and she was literally crying in pain. I asked her, "What's your name, ma'am?" But she was not in condition to tell her name. So after whole workup, since she was 60 plus and she diagnosed with osteoarthritis, so I called her. "You are osteo women. Osteo women." So now let's begin with the osteoarthritis. As we discussed before, that rheumatologic disease are monoarticular involving one joint, oligoarticular involving 2 to 4 joints, and polyarticular polyarthritis involving 5 or more joints. So how about osteoarthritis? Where it fits? So osteoarthritis can be mono or oligoarticular, right? In very rare cases, it's polyarticular polyarthritis, because osteoarthritis is a local biomechanical or wear and tear problem, right? Also, arthritis can be non-inflammatory, inflammatory, septic, and hemorrhagic type. Osteoarthritis is a non-inflammatory type of arthritis, though we can find WBC if we aspirate the patient's joints, but it's not driven by systemic inflammation. As we know that osteoarthritis is a biomechanical wear and tear problem, right? So if non-inflammatory, then we should call it osteoarthropathy. Osteo means bones, arthro means joint, pathy means disease. Any disease involving bones and joints instead of osteoarthritis. But no one is listening me because few people don't want a change. Their mind is already full of crazy steps and they think I'm an idiot. Also, arthritis can involve your DIP, first MTP, wrist and MCP and other joints. Where osteoarthritis involve your DIP, distal interphalangeal joint, which is here, also your PIP, proximal interphalangeal joint, your first MTP, and also your CMC1, right? First CMC joint, which is the most commonly involved joint in osteoarthritis. Also, arthritis can be asymmetric and symmetric type. When we talk about osteoarthritis, it's an asymmetric type of arthritis, and rheumatoid arthritis is a symmetric type of arthritis. Why symmetric? As we already know that rheumatoid arthritis is an autoimmune, chronic, symmetric, systemic type of inflammatory arthritis. Autoimmune means having autoantibodies, right? And as we know that like God, autoantibodies also do not discriminate with your joints. They affect your both wrists, your both joints equally. So now why osteoarthritis is an asymmetric type of arthritis, right? So let's see to it. There are two reasons for that. One, as we know that this is the monoarticular in most of the cases, mean involving only one joint, so technically it become asymmetric. Second, as we know that this is a localized wear and tear problem, right? Remember the tires of your car, they wear out asymmetrically. Similarly, our joints also wear out asymmetrically, because some of us are left-handed, some are right-handed. Also remember an athlete, a footballer, some kicks with their right and some with left leg. That's why, as we know that osteoarthritis is a biomechanical use-based destruction of articular cartilages, hyaline cartilages. Because of these reasons, osteoarthritis is an asymmetric type of arthritis. Also, arthritis can be acute or chronic type of arthritis, like days to week and 6 weeks or more. So osteoarthritis fits here, right? 6 weeks or more chronic type of arthritis. So on aspiration of the joints, you will have WBC and predominantly lymphocytes, right? Not neutrophils, because generally we see neutrophils in acute processes. Let's talk osteoarthritis and rheumatoid arthritis put together. So osteoarthritis, as you know, this is a chronic non-inflammatory asymmetric type of arthritis. Remember the localized biomechanical wear and tear problem. Also, patient will come to with no cardinal signs of inflammation because this is non-inflammatory type. No constitutional symptom because this is no systemic disease, and worse in the evening with use. And patient will be there with the normal ESR and CRP level. Where rheumatoid arthritis is a systemic, symmetric, cardinal signs of inflammation, worse in the morning, also with the elevated levels of ESR and CRP. So this is the complete definition of osteoarthritis. As you know that this is a biomechanical, chronic, non-inflammatory, asymmetric, degenerative joint disease of elderly with no constitutional symptom because this is not a systemic disease, and worse in the evening with huge pain predominates stiffness. As the morning stiffness lasts less than 30 minutes. Stiffness improve with use where pain worsen with use, and also patient comes to with the normal ESR and CRP and CBC levels. So osteoarthritis is the most common type of arthritis. Also the prevalence rises strikingly with age. So highly prevalent or the leading cause of disability in elderly people. Also uncommon in adults under age of 40 and highly prevalent in those over age 60 years. Though it's more common in women than men, and also aging and obesity are the major risk factors. Severe osteoarthritis of hands affecting the DIP distal interphalangeal joint and causes Heberden's node, and the PIP proximal interphalangeal joint and causes the Bouchard node along with the base of thumb. So the commonly affected joints in osteoarthritis include the cervical and lumbosacral spine, hip, knee and first MTP metatarsal phalangeal joint. Though wrist, elbow and ankle are generally spared, osteoarthritis can be diagnosed based on the structural abnormalities or symptoms, and these abnormalities evoke such as cartilage loss and osteophytes. Symptomatic osteoarthritis of the knee occurs in almost 12% of people with age 60 years or more. Also, hip osteoarthritis is roughly 1/3 as common as disease of knee. And lastly, radiographically evidented hand osteoarthritis and the appearance of bony enlargement in affected joints, extremely common in older persons. So thank you so much for watching, and please do subscribe the channel to get all latest videos like this, and also help this beautiful lady, osteo women, to reach and teach more and more people about this nasty disease osteoarthritis. Stay happy, study a lot. Thank you so much guys.